SNOMED-CT, Systemized Nomenclature of Medicine, Clinical Terms, is a very comprehensive clinical terminology standard. The origin can be dated back to as early as 1965, when the Systemized Nomenclature of Pathology, SNOP, was developed. It was then extended to SNOMED by the College of American Pathologists in 1973, and further developed into SNOMED International and SNOMED, reference terminology, SNOMED-RT, respectively. SNOMED-CT also has a UK origin, due to the development of red codes by Dr. James Red, a GP in UK, in early 1980s. Red codes have been used by the UK National Health Services, NHS, since 1985. It evolved from the 4-byte version 1 to the 5-byte version 2, and then the Clinical Terms version 3, CTV3. In 2002, CTV3 and SNOMED-RT were merged to create SNOMED-CT. A key feature of SNOMED-CT is that a clinical term is formally defined by its logical relationships with other clinical terms. This feature enables explicit definition through logics, which is favorable for computer processing and query. Indeed, SNOMED-CT has philosophical backgrounds, where taxonomy of clinical terms is established with the application of ontology, semantics, and description logics. The structure of SNOMED-CT involves three basic components, namely, concepts, descriptions, and relationships. Every component in SNOMED-CT has a unique numeric identifier, called SCTID, which is a string of 6, up to 18 digits. SCTID usually has 8 or 9 digits. It begins with an item identifier, followed by a 2-digit partition identifier, which tells whether the component is a concept, a description, or a relationship, and ends with a check digit, calculated using Verhoef's dihedral algorithm, to ensure the integrity of the SCTID. SNOMED-CT can be extended beyond the international release, to include local or regional content. In that case, SCTID begins with an extension item identifier, followed by a unique 7-digit namespace identifier, which is obtained from the SNOMED International, then a 2-digit partition identifier, and ends with a check digit. In SNOMED-CT, concepts refer to clinical meanings. They are organized hierarchically into different categories, such as clinical finding and procedure. Each concept has a unique numeric identifier, called concept ID. Descriptions are phrases, or names, that are used to describe a concept in human-readable form. Each description has a unique ID, called description ID. There are 3 types of descriptions: fully specified name, FSN, preferred term, and synonym. FSN describes a concept in an unambiguous way, where the category or context that the concept refers to is explicitly specified using a semantic tag, put inside a bracket at the end of the FSN. While FSN is an ambiguous description to uniquely identify a concept, it is not necessarily a name that is commonly used. SNOMED-CT provides preferred terms to name a concept using the words or phrases that are commonly used by clinicians. A concept has one unique preferred term, but a preferred term can be a synonym of other concepts. In addition, synonyms are provided in SNOMED-CT to name a concept. A concept may have more than one synonym. In summary, a concept has one unique FSN and one unique preferred term, while it may have multiple synonyms. There is a unique description ID associated with these 3 types of descriptions. As highlighted, a key feature of SNOMED-CT is to logically define and model a concept based on its relationships with other concepts. There are 2 major types of relationships that are used to define a concept, namely, is a relationship and attribute relationship. They define the characteristics of SNOMED concepts. Is a relationship relates concepts in the same hierarchy. A concept is related to the concept immediately above it in the same hierarchy with the is a relationship. This is also called parent-child relationship, or supertype-subtype relationship, where the lower-level concept and the high-level concept are child and parent respectively, or subtype and supertype respectively. Notice that a concept can have more than one is a relationship with other concepts. This brings in the notion of concept granularity. With is a relationship, concepts of the same kind can be arranged under a hierarchy such that the concept at the top of the hierarchy is most general, those below are more specific, and the one at the bottom is most detailed. That is, a clinical meaning can be represented with different levels of detail. The more levels the hierarchy has, the more granular the clinical meaning can be represented. Thus, SNOMED-CT is flexible in that it can adapt to the comprehensiveness of the available clinical data by coding the data at appropriate levels of detail correspondingly. Attribute relationships relate concepts in different hierarchies. In fact, attribute relationships involve a group of relationships of various types, which are used to establish the types of relationships between two concepts. For example, the concepts pneumonia, disorder, and lung structure, body structure, from two different hierarchies, are related by the finding site relationship. Likewise, the two concepts, streptococcal sore throat, disorder, and genus Streptococcus, organism, are related by the causative agent relationship. Notice that a relationship is assigned for a pair of concepts only when the relationship between them is always true. For example, even though streptococcal sore throat is mostly caused by group A Streptococcus, they are not related with causative agent relationship, but the more general concept genus Streptococcus. Interestingly, we can use directed acyclic graph, DAG, a data structure in computer science and graph theory, to represent SNOMED-CT concepts graphically. A DAG is a graph such that traversals on the graph are one way only from one vertex to another, and traversals along edges do not form a loop. To express SNOMED-CT concepts using a DAG, the concepts are represented by vertices, and the relationships between concepts are represented by edges. Graphical representation of SNOMED-CT is essentially a combination of is a relationship and attribute relationship, which connects two different hierarchies. It can be used to infer relationships between concepts and deduce redundant relationships. For example, given this DAG, it can be inferred that the pain in calf concept is indeed a child of the pain in lower limb concept. The is a relationship between pain and pain in calf becomes redundant, and the graph can be reduced into this form.